give an update on Omicron and kind of where we might be in the next couple of weeks. So just let me start off by telling you that about 58.7% of our population in Lucas County is vaccinated. So we continue to climb ever so slowly. That's a good thing. Our numbers for infection on a daily basis have come down a little bit, and we're in the low 200s, 205 on the average. So we have come down since that peak the first week of December, and let's hope it stays that way. But don't know if that's going to be the case. Let's talk a little bit about other numbers before we get into Omicron. We continue to see increased numbers at our hospitals in Lucas County. Those numbers have come down slightly for daily admits, but nowhere near where we were 2 weeks ago or so, where we're experiencing low 200s to upper 100s admits per those hospitals. So we continue to see our hospitals being inundated, but nothing like Cleveland. If you've heard what's going on in Cleveland, they have significant, and again, I stress significant issues with inside of their hospitals. The ER visits are just enormous, as well as their concerns with trying to take care of people with inside the hospitals. You heard the National Guard is going out to help Cleveland out, both with medical and non-medical personnel. Those hospital systems truly do need it. The concern that we have is what is going to happen. Could Cleveland be Lucas County in the near future? It could be. We don't know. We definitely do know that the holiday season is approaching us, and we do know that at this point in time, 70% of the cases are now Omicron in the United States, where Delta was 30. So you saw a very quick flip from Delta variant being the predominant variant to now Omicron. The research, again, is still a little muddied with the idea of Omicron. We do know that it's much more infectious than the Delta. It appears that it has similar issues with symptoms and illness. There are some reports that maybe there's less, but again, as we go through the coming days to weeks, we'll get more clarity on that. And again, that Omicron is what we're going to be experiencing here in the very near future. I'm sure we have cases inside of Lucas County already. As you know, I just said 70% of those cases in the United States are Omicron, 70% of them. What do we expect? Well, let's backtrack a little bit. The reason why we wanted to get those tests out to the community was to make sure you utilize those before you really go see family and friends where one individual can infect multiple. So hopefully those test kits are doing its job out there in the sense that if you're sick, you need to stay at home. You need to isolate. Those individuals should follow those quarantine protocols, as we've talked about now for almost 2 years, of what they need to do to make sure that they too don't have the opportunity to infect somebody else. Omicron in the coming weeks. Again, nobody has that crystal ball, but we could surmise that the holiday season coupled with Omicron, we would be seeing significant cases of Omicron come January in Lucas County. We don't know, because we are approaching that 60% of those vaccinated, if that's going to help us or not with Omicron. We think it will. We know that some of our other counties around us, close to us, aren't that high. So again, they could be seeing different issues than we will after January. We continue to, again, stress the idea of getting vaccinated. It truly will help get you to a point where you could feel much more comfortable about doing things. But we know that being vaccinated has helped with the idea of severe symptoms, not having them. If you do start having severe symptoms, they may not be as bad as they could be. without being vaccinated. So again, that second dose is so important. But I want to talk to you about this is the third boost, the third dose for many of us, which is that booster dose. It is important that if you haven't gotten it yet, please do. That will, again, boost your immune system. There's research out there where there is several-fold increase for immunity to even to the Omicron variant with that booster shot. So please, 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 if you haven't gotten your booster, please go out and find somebody who can go ahead and give that to you. Again, we'll be here at the health department operating our clinic on the first floor here. We will resume work at the rec center come the first of the year. We'll probably be looking at increasing those days as well too. Discussions with the Ohio Department of Health, they are looking at January being a significant month for boosters and other vaccinations. The idea here is people will be hearing about Omicron much more. We'll be looking at possibly those inundations of hospitals again, even further than they already are, and the need for people to go ahead and get vaccinated. I think I want to leave us with this before we open up the questions. You know, we are going on 2 years. We are all COVID fatigued, whether it's just the public, our medical professionals here in public health, so many others. We continue to need to stem the tide the best we can of COVID in our communities. You know, nobody wants to get sick, but nobody wants to end up in the hospital. And we can go ahead and do things like we've talked about to make sure that we reduce that chance. Again, getting vaccinated, getting your booster, staying at home if you're sick, wearing a mask when you're out and about in very crowded areas. We see in Cleveland, many venues have canceled their gatherings, whether it's at the theater or some sporting events. So again, that idea of if you don't need to go out, don't go out. Making sure that we're taking care of ourselves is the big thing as well too, keeping ourselves healthy so that even if we do get the variant, that we can fight it off. With that in mind, it is the holiday season, and again, I know many of us are going to travel. Please take as many precautions as you can so that you don't infect a loved one or a loved one doesn't infect you. With that in mind, Maj, I'd like to open that up for questions.
Sure. If anyone has a question, can I use the raised hand function?
Brian?
Yep. Brian, go ahead and unmute yourself and ask your question.
Eric, you know, a couple years ago, we had talked about building out the ICU, possibly over at the convention center.
Yes.
Have you guys, are you looking at these plans again if hospitalizations begin to surge?
Brian, that's a great question about the build out at the center for again, like a COVID alternate care center. There are talks about that, but really that type of stand up is extensive, and we probably don't need that. But the hospitals at this point in time, you need to understand they're talking several times a week amongst each other. I'm on those calls. Many options around the table depending on what happens. So they are priming the pump, if you would, to make sure that we can respond adequately to any issues. You know, the idea of everything from having 1 or 2 hospitals being COVID hospitals, looking at extra individuals to come in and help. National Guard, you're seeing that in Cleveland, the Cleveland area. There's a whole host of things that the hospitals are looking at. So they continue to plan and put us in the best position to make sure that those hospitals themselves have the ability to, again, take those trauma patients, that heart attack, that car crash, that stroke, and make sure that they're treating them just like they were prior to COVID. And again, that's an uphill battle because of as many people are in those hospitals with COVID at this point in time.
Kaylee, go ahead and unmute yourself and ask your question.
Yeah, hi Eric, thanks for doing this. One thing I've heard over the last week or so is that a lot of people aren't really worried about COVID. We've been in it for long enough and they're just kind of over it basically. And then now comes Omicron, and a lot of people are reading that Omicron may not be as, you may not have as symptoms as deadly or as bad as Delta. So why continue to get the booster or, get the vaccine, wear your mask and all of that stuff, even though it transmits faster, it's not as severe. So what are the recommendations for what people are hearing about it and them not being worried about COVID?
Kaylee, thank you. A couple things here. We have competing ideas about Omicron. Yeah, there are reports that it's not as severe. Then there's reports that it's just as severe as Delta. Again, the idea here is we don't want to take the chance of either or. Even if it's not as severe as Delta, we're still going to have increased numbers reported to the hospitals, because you can just imagine, if it's more infectious, you're going to have more people who get sick over Delta, and a greater portion of those individuals will be reporting to the hospital because of concerns. So even if it is less severe, you're still going to increase those numbers, and you're still going to impact the hospitals. Then the flip side is, what happens if it is as severe as Delta, but it's even more infectious? So right there, either side of the coin, we still have to make sure that we pay attention to what could stem the tide to those hospitals and getting people sick. And again, it goes back to vaccination and those things we've talked about. I understand everybody is COVID fatigued. I am, my family members are, my friends are, the community is, but we still have the disease out there, which is going to impact people to the extent where they are going to pass, whether it's not as severe of an Omicron variant or not. It's not just not going to affect people. There are going to be a segment of our population that are going to end up with very negative consequences. Maybe not as much as Delta, maybe more, maybe just as much. But again, you are really truly, I guess you could say, I heard this the other day, you're rolling the dice. So again, not being vaccinated, that's a real concern, but not taking other precautions, you're just asking for this variant to again infect you.
Anna, go ahead and ask your question.
Yes, with everyone doing possible Christmas gathering, holiday gatherings, do you suggest that people do the rapid home test that you guys were passing out? And they went away really quickly, 20,000 in one day. So are you saying people should get tested before they visit family and friends this season?
Well, there's those rapid tests available at the pharmacies too. We gave out 20,000 of those last week. So yes, the idea here is to make sure that if you have those tests, to be able to use them. Reporting to the ER to find out if you have COVID or not because you want to go visit your family, or probably is not the best use of that ER and or of the time. Plus, you're going to be there 3 or 4 hours, and then you're taking the chance of catching COVID. So the idea here is utilize those tests that are available. Again, the thing here is that we want to make sure that we're taking every possible avenue, if we're going to travel, to make sure that we're not infecting other family members or friends or whatever we're doing. And those take-home those at-home tests are a good tool to be able to do that.
I have a follow-up question real quick.
Sure.
How about if you have family members who are unvaccinated, should you ask them to be tested?
Yeah, again, that's going to be between you and your family members. It's not seeing family for years now, that's very tough. If you're going to be around unvaccinated individuals, you probably should wear a mask. You should ask them to wear a face covering as well too. But again, if you're out and about, you can plainly see that people, even in crowded areas, aren't wearing face coverings. So again, that's an internal family matter that you're probably going to take up. I don't know how many arguments that'll start, But again, the more you can protect yourself and your family members by making sure that people around you are vaccinated, they're wearing face coverings, they're doing the best things they can to make sure that, again, the virus is not spread amongst each other, the better off we all are.
Zainab, you can go ahead and ask your question.
Thanks, Shannon. Thank you, Eric. So I was going to ask a very similar question to what Mike asked. Is there any way that people can access those take-home kits before the holidays?
Yeah, there are supplies out there, like I said, at pharmacies, you know, the pharmacy stores. Again, you don't need a prescription for it. Again, anybody who has those test kits still available that we've passed out last week, those are there to use for this purpose. So those kits are out there. Again, I don't know how many. But again, I would call around if you wanted to get one. Anything else, ladies and gents?
Oh, good, thank you.
All right. Thank you so much, everybody. Again, happy holidays to everyone. Please take precautions as you can. I know many of us are going to be seeing family members. And again, there are ways to protect yourself and your families. Please take those and be safe wherever you are this holiday season.